So it's 12 o'clock, so I think we'll get started now. So thank you everyone for joining today. Welcome to our webinar, ADHD in Children and Youth, the Basics. Our presenter today is Dr. Ryan Chan from the BC Children's Provincial ADHD Clinic. Thank you so much to everyone for joining us today. My name is Michelle Horn, and I'm the Program Manager for the BC Children's Kelty Mental Health Resource Centre. Before we begin, I would like to acknowledge with respect and gratitude that I live and work on the beautiful, unceded Coast Salish traditional territory, and I give thanks to the Musqueam, Squamish, and Tsleil-Waututh nations. Also, before we begin, I just wanted to provide a very brief overview of what we offer at the Kelty Centre. So we're a provincial mental health and substance use resource centre, and we assist families across the province by helping with understanding and navigating the mental health system, listening and offering peer support from parent peer support workers through a collaboration with FamilySmart, and connecting families to resources and tools. And we will be putting our contact information back up at the end of the presentation, so don't worry about having to write anything down now. Also, a note that this webinar is being recorded and will be available on our website at keltymentalhealth.ca/ADHD webinar series. We'll have this recording up on our site by February 10th, and you can also find recordings here from the other webinars in this ADHD webinar series as well. You'll also receive an email with this link tomorrow, so no need to copy it down. Also, just a few housekeeping notes. So as mentioned at the beginning, everyone is automatically muted and your cameras are turned off, so we can't see or hear you. You don't need to worry about that. You'll have an opportunity to ask Dr. Chan questions after the presentation. So please submit any questions through the Q&A icon you'll see at the bottom of your screen. There has been an option enabled where you can vote for questions that have been asked by others that you would also like to see answered, as well as an option for you to submit your question anonymously. Please submit any technical or logistical questions, such as if you're having issues with your audio, through the chat icon. At the end of the webinar, a survey will pop up, and we would really appreciate your feedback so we can improve future webinars. We also just wanted to note that the information in this webinar applies to the context of British Columbia. If you are in another jurisdiction, please consult your local health authorities for further information. Okay, and so it is now my pleasure to introduce our speaker today. Dr. Ryan Chan is an expert with ADHD and disruptive behaviors. He is a psychiatrist and the past clinical director of the ADHD clinic at BC Children's Hospital. Dr. Chan is passionate about medical education and health promotion. He delivers lectures to parents, pediatricians, and medical trainees, and recently participated in an ADHD podcast for parents through Kelty Mental Health, Where You Are podcast series. So thank you so much, Dr. Chan, for being here with us today, and I'll pass things over to you now.
And thank you, Michelle, and our friends here at Kelty, and for you, our viewers, for having me today. ADHD is such an important topic for so many. So before diving in, I'd also like to respect and acknowledge the land on which I present from is the traditional territory of the Coast Salish peoples, including the unceded homelands of the Musqueam, Squamish, and Tsleil-Waututh nations. We sure are fortunate to live in such beautiful territory, especially for its nature and outdoor activity. Speaking of movement, did you know that movement can vastly improve your learning? I came across some really interesting reading the other day about whole body learning. Why don't we try it out today? As you listen, give yourself breaks and move your body. Also, if you don't have back, shoulder, or neck injuries, let's try a general stretch together, right? To energize you for the day. Get ready for learning. Ready? Please stop if this causes any discomfort. Okay. First, take one hand and cross that arm over your body. Take your other arm, pull that arm closer gently to your chest, and just hold it there for 5 seconds. 1, 2, 3, 4, 5. Okay, shake it off. Okay, that feels pretty good. I've been sitting all day. Take your other hand, cross it over your other side of your body, and again, pull gently closer to your chest. 1, 2, 3. Okay, and if you're willing and able, move your arm to the back of your body like this, okay? And just gently do a patting motion on your back, okay? Now, repeat after me. I am amazing. I made time to be here today. I thirst for knowledge. I am no ordinary parent. In fact, I'm a great parent. Good. All right, now relax. Thank you so much for joining me for that. Okay, that was our bit of a movement break and sort of self-talk here. I have to admit there was a bit of trickery involved, but all with good intentions. You see, because I know that as a community with ADHD, we need to be compassionate with ourselves, we need to have fun, and we need to be with our kids and others. So let's get the show on the road. Okay, so this webinar will focus on the basics of ADHD and how it affects children, youth, and their families. It will debunk stigmatizing myths of ADHD, reveal neuroscience findings, encourage healing through understanding. Note that treatment will be discussed in upcoming webinars, so stay tuned, okay? So there's a lot of confusion out there with ADHD, attention deficit hyperactivity disorder, and rightly so. I mean, the name has changed several times over the past century. The name we have now, I mean, it's okay, but it might imply that ADHD causes hyperactivity and focus problems all the time. But that's just not true. You can be unfocused, but not be hyper. We used to call that ADD. Now we just call that ADHD in attention presentation. And children with ADHD can have major focus problems, but not all the time. And then they can focus for hours on things that they love to do, like video games, television, and building Lego. So it's pretty confusing if you just go by the name. So ADHD is much more complex than just not being able to focus and being too hyper. We now know that ADHD impairs the brain's ability for self-control and self-management, and that brains with ADHD are different than those without. We'll talk more about this later, okay? While everyone can have troubles with self-management sometimes, those with ADHD have these problems the majority of the time. Saying everyone has ADHD is like saying everyone has asthma, just because we all feel winded sometimes when we run. We know that ADHD runs in families. We also know that 5 to 10% of children have ADHD, each of them unique, but share some common characteristics. To better understand ADHD, let's look at how some children describe their ADHD. The following personal stories are from understood.org, an organization dedicated to helping those who live and think differently flourish. Let's listen to Julia first. So it looks like we may be experiencing some technical difficulties here. I'm going to try that share again. All right, we're back on track. Here we go.
My name is Julia. I'm in 2nd grade, and paying attention is really hard for me. When I have trouble paying attention and go daydreaming, my daydream land's called La La Land. All I know is I'm spacing out, and it's kind of like I can't see anything. It makes me sad because I can't like really learn. I was in La La Land, and they called on me, and I had no idea what was going on, and it was super embarrassing because I had to think of something that I could say to like save me. And everyone was kind of like making fun of me, and they were judging me like differently.
So that was Julia. She talks about how her symptoms of ADHD affect her and how it can affect her self-esteem. All kids are bombarded with distraction. Typically, developing kids can filter out distraction and maintain their focus on what's important. If they get distracted, they remember where they left off from and shift back. This is much more difficult in kids with ADHD. Let's listen to Noah talk about his challenges with hyperactivity.
Your mind is telling you don't move, but your muscles and your body and everything else is telling you get up and move your feet. You're either tapping your knee, tapping your hand, playing playing with the desk, doing something that makes you want to move, but you can't. When a teacher would try to get my attention, I would kind of play a TV show in my head. Like, a TV show would literally play in my head. I would make all these weird little sound effects, a little like... Teacher will be like, stop that. And I'll be like, okay. Then I'll just go back to doing it again. They'll be like, stop that. And I'll be like, okay. And then I'll just go back to doing it again. And it really gets them frustrated. And I'm more frustrated with myself because I can't stop. Didn't have many friends, probably one friend. And if that, probably within a couple weeks, he thought it was weird and he didn't want to talk to me.
We can see how that is also painful for Noah and how it affects him. Some kids with ADHD have brains wired for movement. They crave movement, seem less aware of it, and have troubles controlling themselves. They struggle to use their brakes. This applies not just to their bodies, but to their impulsivity in general. And we can feel how it makes them feel kind of alone. Let's now listen to Scott, who's in grade 5.
My name is Scott. I'm in the 5th grade, and I struggle every day to stay organized. I'm one of the most unorganized people I know. It sort of feels like you're the worst because you're always late to all the classes. Why did everyone else just finish their book report and I'm just starting? You don't want to admit that you can't do it because you just can't find your binder. I'm still on the first thing and everyone else is on the third thing because they can just flip through their binder, go ahead and out the door in 30 minutes, and I need to stay behind and keep looking for it. I just can't find anything. It just feels bad.
It just feels bad. I'm just going to switch us back now. Okay. Just as Scott talks about, we teach kids to organize themselves, but kids with ADHD struggle to keep up. They're more forgetful, they misplace their things, they lose track of time, have trouble sorting out their thoughts, and often don't know where to start and how to finish projects. This leaves many kids feeling inadequate and alone. So while not formally recognized as part of the diagnosis, kids with ADHD often struggle to control the intensity of their feelings. We call this emotional dysregulation. Jessica McCabe is a champion for ADHD who herself has lived experience with the condition and provides valuable education. Here, we'll play from her YouTube
Organization and planning can be a big challenge for some of our kids.
Her YouTube channel called
and it's not because they're not trying.
She has a clip on emotional dysregulation.
This is what we know. Those of us with ADHD experience normal emotions. As in, it's totally understandable that you got upset when that person insulted you. Most people would. But the way we feel and respond to those emotions can be more intense and last longer than it does for neurotypical brains. Why? Even though we experience normal emotions, our brains have trouble regulating those emotions. The ability to regulate our emotions is what allows us to calm down and make good choices when something gets us worked up. Sounds simple, but emotional self-regulation is actually a pretty complicated 4-part process, and it relies on stuff the ADHD brain tends to have trouble with. First, inhibition, as in not impulsively reacting to an emotion. Not super easy for those of us who are naturally impulsive. In fact, according to Dr. Russell Barkley, the more generally impulsive we are, the more emotionally impulsive we are too. And with that kind of impulsivity, we may not even make it to the next part. 2, self-soothing, the ability to calm down that initial emotion. Most of us do have ways to self-soothe, but they're not always healthy. 3, refocusing our attention. Literally the exact problem that Yep. Moving on. 4, responding in a way that makes sense based on our goals. This shouldn't be too hard, right? We just have to remember what our goals are. Then be able to remember what the other person said, what we wanted to say, how it worked out for us the last time we responded that way, consider all the different variables in this particular situation, and then predict the possible different outcomes based on those responses, and then choose the best action that fits with our goals. Actually, that's a lot for somebody with ADHD. We have limited working memory. This kind of trouble with emotional self-regulation is obviously a problem for things like anger and frustration, and that's a lot of what gets us into trouble at school, work, and in our relationships. But
Of all the features of ADHD, emotional dysregulation may be the most damaging for relationships, just as Jessica McKay points out. So as illustrated, all kids with ADHD face a lot more hardship and have to work extra hard to keep up with their peers without ADHD because their brains struggle with self-management. Leading experts in the field like Dr. Russell Barkley and Dr. Thomas E. Brown have explained this through conceptualizing ADHD as a disorder of executive function, what we've referred to thus far as the brain's management system. The ability to organize ourselves, start and stay on task, self-monitor, remain motivated, regulated, and able to course correct as needed to complete our goals. These are executive functions. We use analogies to aid in our understanding of the brain's executive functions. Dr. Brown uses the analogy of a symphony conductor who harmonizes each piece and each musician's sound into one cohesive piece. For children, I like using the analogy of a teacher who manages the classroom the same way executive functions manage the brain. I help children understand that they can use their brain's full potential to shine if their brain's teacher does its job. But all too often, their brain's teacher is pesky and asleep on the job. So as we can see, inattention, hyperactivity, and impulsivity.
ADHDers experience emotional dysregulation with other emotions.
Not captured in the diagnosis of ADHD are several other impairing challenges associated with ADHD. So before we summarize this section, I'd like to add a few extra details about ADHD. Because the name ADHD is incomplete, a diagnosis often includes a short description, either predominantly inattentive, hyperactive and impulsive, combined, or unspecified presentations. Another point, ADHD is generally first seen in childhood, but can go unrecognized. Often, bright children with mild symptoms of ADHD may go undetected, even though ADHD is first seen in childhood. This can happen especially if their parents organize their life for them. As such, ADHD features are on a spectrum. In milder cases, a child may not reach their potential, and in extreme cases, ADHD can wreak havoc. We also see that ADHD has nothing to do with intelligence. You can be an absolute genius and still have ADHD. That said, other developmental delays, including learning disabilities, more commonly exist with ADHD than in those without. In fact, ADHD, more often than not, coexists with other challenges. Did you know that 2 out of 3 children with ADHD have a coexisting condition? Each coexisting condition generally makes a child's life more difficult and often makes diagnosis and treatment more challenging. In my experience, kids with ADHD become adults with features of ADHD. They don't grow out of it. ADHD may look like it improves over time. Why? Hyperactivity often subsides by high school. Number 2, brains fully mature by the time one reaches their mid-20s. By then, young adults have more coping tools and choose careers that suit their strengths and interests. For example, that child who used to spend hours building Lego now spends hours designing houses or designing engines. So while there are improvements in hyperactivity and impulsivity over time, the more impairing inattention, executive function challenges, and impulsive decisions and actions generally persist into adulthood and may contribute to greater unemployment, divorce, addiction, and other mental health challenges. Despite ADHD's impact over the lifespan, it can be managed. Simone Biles, a 4-time Olympic gold medalist, is a great example. She reminds us that ADHD can affect anyone and that children with it can adapt, rise above, and reach their dreams too. So let's review the key aspects of ADHD. ADHD affects the brain's executive functions, its management system. It's highly genetic. ADHD endows common characteristics across the spectrum. ADHD is highly misunderstood. Everyone does not have ADHD. To have ADHD, it must be a problem. And ADHD can be identified and managed. Kids with ADHD can blossom to their fullest potential. To do this, it's important to catch ADHD early. So parents commonly ask me when they should be concerned. They're always worried about the future. That's what it means to be a parent. But we know that ADHD presents with risks. How many of you have worried that your child may dart out into traffic How many of you have worried that your child may fall from a really high place? Or how many of you have gotten into yelling matches at home, either with your child or your partner? And how many of you have gotten calls from the school about your child's concerning behaviors? Being a parent of a child with ADHD is hard. It's important that you trust your instincts. You know your child best. Use your child's self-esteem as a guide to tell you when to be concerned. You know, in my practice, all too often, I see ADHD rob a child of their self-control and then their self-esteem. We see this happen right before us. Imagine how many times this child hears from parents, teachers, coaches, and even friends on the daily, stop, don't, listen, focus, I just told you, if you just. And then compare that to the number of times the child hears, I appreciate when you really helped when you stuck with it, you're a good friend. From time to time, check in on your child's self-confidence and self-compassion. Ask from them what they like about themselves, what they're proud of. If possible, seek help well before your child has nothing good to say about themselves, or worse. Now, there are times, and in fact common times, when parents and teachers become more concerned about ADHD. Generally, during each of these transitions, we expect more from a child's self-management. And when we see them fall short, that's when we start to get concerned more. So if you're concerned about your child, there's a common pathway for assessment in BC. Generally, we start off at the primary care physician's office, either the general practitioner or a pediatrician. If needed, a referral could be made to a subspecialist, such as a developmental pediatrician, a psychologist, or a psychiatrist. And if the further need arises, a referral could be made to a specialty clinic, like the provincial ADHD clinic here at BC Children's Hospital. Now, this image reminds us that not all things that look like ADHD are due to ADHD. A well-rounded assessment considers what might cause or worsen ADHD-like features. What are some examples? Well, number one, I expect all preschoolers to have a bunch of ADHD-like features because it's normal for them to not pay attention, to be really hyper, to have troubles with organization. Okay, what else? Well, medical and general health. If a child, if we're unaware that a child can't hear, has maybe fluid buildup in their ears, well, suddenly they're going to start not being able to listen and not hear as much, maybe not pay attention. You know, if a child has severe insomnia or develops it, suddenly they might get really hyper. Their emotional control, their behavioral control could really go down the tubes. Similarly, if a child develops seizures, it might look like they're developing features of ADHD. What about other developmental conditions? Well, we know that conditions like autism and also fetal alcohol spectrum disorder share significant overlap with ADHD. They can look very much the same, and it might even need a subspecialist's opinion to know the difference between them. If I see a child primarily with ADHD features at school, that makes me think more about learning disabilities, because ADHD, as we talked about, its impairment happens everywhere, not just at school. And in fact, the most common mental health condition that presents with ADHD is oppositional defiant disorder. Why is that? Well, if you look at the four of 8 criteria of oppositional defiant disorder, and then you look at the features of ADHD, you can see that those 4 criteria of oppositional defiant disorder come directly from as a result of having ADHD. It's also important to see if a child has anxiety, because often anxiety can make ADHD features look worse. And it can also make treatment harder, right? Child may not respond as well to the treatment if they have anxiety. A lot of parents also ask if there's a test for ADHD. There is no test that can tell you if someone has ADHD. A diagnosis comes solely from a clinician's judgment, who uses a bunch of tools to help them make that decision, like clinical history, an examination, ADHD rating forms and other rating forms, report cards, teachers' forms, letters from the school. While I'm aware that some practitioners have started using neuroimaging or EEGs to aid in the diagnosis of ADHD, at this point in time, these tests can't reliably diagnose ADHD and are highly expensive. Some parents wonder if they should get a psychoeducational assessment. This type of assessment tests for cognitive ability, or IQ, and learning differences. They are not mandatory, but they could help sort out learning differences and low IQ from ADHD and can help guide intervention. And so many parents want to know where ADHD comes from. As a matter of fact, there is a lot of information on search engines, but I recommend that you fact check and vet your sources. Let's talk about the causes of ADHD. While the cause of ADHD remains under study, it's most likely related to a complex interplay of factors. Let's first look at what we've learned from neuroimaging and neuroscience. Okay, now this slide, it shows a typically maturing brain from early childhood into adult years. The blue areas note areas of maturation, okay? This is the same data represented in a dynamic view. Now, some neuroimaging studies imply areas of slower brain development in ADHD. For example, in this slide, brains aged 7 to 13 with ADHD in blue on the top here are compared to those without ADHD in the purple down here. The color white notes areas of thinner and less developed areas of the cortex, whereas colored areas are thicker and more mature. One study found a maximum thickening of the cortex at 7 years of age for typically developing children compared to 10 years of age in those with ADHD. Now, these findings support observations from parents that children with ADHD seem up to 30% immature compared to peers, especially with self-management. Now imagine, what would be the impact on a 10-year-old who may have executive function like a 7-year-old? How would that 10-year-old fare when eventually placed in high school? So rather than specific locations of the brain, neurofunctional and neuroimaging studies have identified deeper networks that work together. Some studies suggest that these networks are not as well calibrated in children with ADHD. For example, the DMN, the default mode network, is thought to be responsible for daydreaming and mind wandering while we're awake and resting. It generally turns off when we need to pay attention. If the DMN stays on when it should be off, our minds can wander instead of focusing on a task. Now let's shift to a more microscopic level of the brain. Our brains are a collection of neurons, billions of them working together. To function properly, these neurons need to talk to each other. This slide shows how two neurons communicate. The top neuron releases neurotransmitters seen here in red squares, which when received by the next neuron, passes the message on. When the message is complete, the extra neurons are pumped back up, almost like recycled into the first cell, or they're swept up, kind of thrown away. Miscommunication occurs when there's an imbalance of a neurochemical. So in ADHD, studies suggest an imbalance of the neurotransmitters dopamine and norepinephrine, especially as it affects the frontal and deeper regions of the brain, responsible for motivation, attention, organization, emotion, and motor control. Medications for ADHD increase neuronal ability to use its dopamine and norepinephrine to more effectively pass on messages. As our understanding of the neuroscience of ADHD grows, so does our understanding and the importance of genetics. So in my practice, I often remind parents of the nature of things. Apples don't fall far from trees. Studies suggest that genetics influence up to 75% of the risk of ADHD. That's huge. That's nearly as strong as how our height is predicted by genetics. A child with ADHD has up to a 1 in 3 chance a parent has ADHD, a 1 in 2 chance a sibling has ADHD, and up to a 90% chance that an identical twin will have it. Researchers have also searched our genetic code, or DNA, for ADHD hotspots. For example, one area of risk involves the gene for the dopamine receptor, DRD4. Instead of finding a few very high-risk hotspots, their research revealed numerous spots of very, very small risk. So it's kind of like if you had one restaurant in mind and you went to Google Maps and kind of zoomed out and you punched in restaurant, right? You don't just get one pin or a few pins, you get a bunch of pins, and that's what happened there. So we now believe that ADHD happens when someone has enough of these very small genetic risks in their DNA that add up to give them ADHD. So, but they took closer look. And out of the hundreds of potential genetic differences in ADHD, a recent large-scale analysis discovered 12 risk locations associated with, well, what did we find? Brain formation, brain function, and common challenges like learning, depression, and obesity that are associated with ADHD. So in fact, it's these new discoveries like these that bring us closer to unraveling ADHD and further improving the lives of those living with it. So while 75% of the risk of ADHD is felt to be encoded in our DNA, one's exposures and environment also increase one's risk. So while some studies suggest greater association of lead poisoning, head trauma, low birth weight, and fetal exposures to cigarettes or alcohol in ADHD, there is no convincing evidence that parenting style, TV, or video games cause ADHD. You know, this last point about parenting hints at the unfair biases, blame, and stigma for those living with ADHD and their families. Let's be absolutely clear. ADHD is no one's fault, least of all parents who give every ounce of their energy to their children. You know, we can't control our genetics. When we have children, the chromosomes from mom and dad literally line up like a genetic slot machine. We never know what we're going to get. Is it going to be a bell, cherry bell, bar, bar, bar? Who knows? We just hope that we have a healthy baby. And you know what? All of those babies will be blessings in their own right. And some of them will even have ADHD. So as parents, and being one myself, my hope is for all parents, teachers, family members, acquaintances, to show compassion for one another at the grocery store, at home, at family gatherings, at school, because we can't control what nature does to us, our babies, or our brains. You know who speaks to that much better than me is a parent who has their own child with ADHD. So let me switch over here to something really powerful. So I'd like to take a minute to honor and recognize a really special parent of a child with ADHD. A couple of years ago, Nina did a podcast with my friends here at Kelty Mental Health, the Where You Are series, the same series you're watching now. I really recommend that you listen to her describe her journey. It's super powerful stuff. Here are some excerpts from Nina on parenting ADHD.
Do that. So the notion that ADHD is because of bad parenting, there's nothing so infuriating to a parent with a child of ADHD than hearing that. Like parents with kids that are raising children with ADHD, they've tried all the typical stuff, all the regular things that all the other parents are doing, and it's working for their kids. It's just that it's not working for our children. For us now, after taking the educational course, I've gotten a bit of an attitude about it because it's like, you know what? No. Like, my child is different. I have to make accommodations, and I am not going to apologize for it. We need to be more accepting and not feel ashamed, because there's a lot of judgment out there.
So really moving stuff. And here we are again with Nina.
Yeah. Like if I could say something to myself, 4 years ago, it would be that like acceptance and don't be apologetic about the accommodations and the parenting that you have to do, because it does differ and it does stand out. And just be kind to yourself. Like it's not an easy route, and just you have to, and this is something I still struggle with. My husband's a little bit better at it, but stop caring about what other people think. Like you have to have a really like badass attitude, and just no, like this is us. This is what we do. If you have a problem with it, then that's your problem, not mine.
I think those are some really wonderful.
Okay. I really admire Nina for speaking so courageously and from the heart. It's important to know that you are not alone, and as a community for ADHD face a lot of stigma, but our voices do matter. You know, in addition to Nina, I also really admire you, our listeners, who are on a journey of truth. You face your own obstacles. I remind you that the difficult path, like this one, holds meaning and significance, and that ADHD can be overcome. Tune in to future talks in this series because it will address just that. So to finish off, I want to offer you a sense of what success with ADHD can look like, starting with Julia, who we met earlier on understood.org.
I can still listen while doing something else. And I like doing that because it's like doing two things. One thing's listening, and the other thing's kind of doing something. I can doodle while listening, and that's naturally the best way that I listen. Another strategy that I use is to, I can ask my teacher if I can take like a lap around the school, like walking around. If I like get stuck on my chair, I mean that helps me a lot. And also we have the fidgets that we can play in with our hands. A fidget looks like this, and this one's squishy. You can squeeze around and it doesn't really break or pop. It's like a toy, but we use it as a tool. Keeps me from going into La La Land. My parents both have ADHD, and I mean, they went through the stage I did, where I didn't know it was wrong, and they helped me get through it, and I love that about them. Well, I love them in general, but still.
Oh, just a note, Dr. Chan, you're on mute.
Thank you very much for letting me know. So I was saying that Julia is a very special girl, obviously, and just like all of our kids. And she talks about how her superpowers can help her feel successful with ADHD. I also want to hear about Scott, who talks a little bit about positive self-talk and persistence, okay, and how that can be important on one's self-esteem. In fact, we did a little bit of positive self-talk earlier today. All right, so let's listen to him.
I'm getting better at it, but it's still really hard for me. Instead of just saying I'm not good enough to find my papers for the right class, saying that I can do it and that I don't give up on it. Like my homework folder, I put the homework that I need to do in one side, the homework I've done in the other side. And now I use labels in my binder for every binder. So like, if I am late, I'm not as late because now I can find the things in my binder. And now if I'm not usually late to subjects, but when I am, I'm only like 5 minutes late, not 10. I get to do what everyone else does and not feel left out because I'm the last one. Woohoo, I made it to social studies on time.
So woohoo is right. I mean, persistence and small changes, it really adds up at the end. And last but certainly not least, let's not forget what that progress can do when there's unbridled talent, grit, and perseverance. What can happen despite ADHD? Okay, so to finish off, I want to borrow from the ever-famous Leonard Cohen, a quote that seems pretty salient today. Ring the bells that can still ring. Forget your perfect offering. There's a crack in everything. That's how the light gets in. Thank you. I think at this point, there's here are some resources that you can get a copy of. And at this point, we are happy to take some questions and answers. I wonder if I can turn it over to Michelle to help guide this process.
Absolutely. Thank you so much, Dr. Chan, for that amazing presentation. There were so many wonderful examples in there that were just so powerful. So thank you so much for this presentation. And thank you to all of you for submitting such wonderful questions. There have been so many that have been submitted in the Q&A. I've been looking through them. Excellent questions. We will try to get to as many as we can during our time that we have together today. If we don't get to your question, you're more than welcome to email us at the Kelty Center, and we have parent peer support workers who are standing by ready to support you and help you with your questions. So maybe we'll just jump right into the questions so we can get to as many as possible. And I will just make a note, I've been monitoring the questions. There's been a few that have been specific questions about treatment. As Dr. Chan mentioned earlier, there's a webinar coming up on February 10th that is focused on treatment options for children and youth with ADHD by one of Dr. Chan's colleagues in the ADHD program. There's still room in that webinar to register. So I encourage you to register for that one, and we'll really be getting into the details about treatment at that one. Okay, so with no further ado, the first question that we have here is a question from a parent whose son was kept in class while the other kids went outside to play as he wasn't done his assignment. And is this something that the teacher should be doing with the child with ADHD, as the child was upset that his friends were going out and he had to stay in?
You know, that's a really, really good question. So not being there in the situation, it's hard to comment on what should have or what shouldn't have done, but my heart really goes out to the child who was kept behind. I mean, what does that do to a child's self-esteem when we keep them indoors and say that they can't be with everyone else? You know, so it's a problem because, you know, a lot of times this might be happening, and I think that one of the concerns is that the child with ADHD might be falling behind academically. And so I guess the question there is, what would happen if the child's academics are allowed to slide to the point that they're so far behind their peers? What does that do to their self-esteem? So all around, it doesn't sound like a good situation. It's a hard situation. But often, and I think this is going to be addressed in future talks, is that we really do advocate for accommodations for kids with ADHD. We know that their brains are set up differently. And so our expectations ought to be kind of calibrated with their abilities, not what we think they ought to be able to do. So if a child, you know, not uncommonly, I'll get a kid who can be actually quite smart, but they don't do their work at school. And so how can we entice this child to show us what they know, to learn? Well, maybe we reduce the amount of asks that we have. Okay, instead of 15 math questions where you repeat a bunch of questions, you do these 4. These 4 show me that you've got that ability, that you've understood what we've talked about. So why make them do 15 when they can show us what they can do in 4? Maybe that'll take less time for them. So that's just an example of one of hundreds of accommodations that can be made for a child. And future talks will address that. There's also books on it, Executive Function 101 PDF online. There's all sorts of, Attitude Magazine online, Kelty Mental Health. There's going to be lots of resources out there to talk about how do you help a kid at school, right? Attitude Magazine online specifically has a section that has like school tool work attitude, ADD, Attitude Magazine. It actually has a section on like school tools, like a PDF that you can download and work with the school on. I'm sure my colleagues can talk more to that when it gets to the treatment section, okay? But really good question.
And we will be sending out a link to these resources that Dr. Chan mentioned today in an email that you'll get tomorrow, including the magazine, Jessica McCabe's videos, as well as some others that were mentioned. So you'll get that link tomorrow. Okay, so the next question is around the process for diagnosing ADHD. I know you spoke a bit about pathways to assessment, but this parent is a bit confused because the pediatrician is saying the school starts the process and the school is saying the pediatrician starts the process. So just if you could provide any clarity on kind of who takes the lead on this.
Sure. So I would love parents to take the lead if they feel comfortable. I truly believe in empowering parents. I mean, we know our kids best, right? But we do also rely on others to give us some feedback about our children. So the school can give us feedback about how our child's doing at school. And when I said earlier, trust your instincts, what I also meant by that is because you know your child best, and if the school is giving you kind of some observations time and time again about your child, you know, that ought to align with what you know of your child. Mostly you would likely say, oh yeah, I kind of get that. You know, I see that at home too. And if you do see it at home, and if you are concerned about it, that's when personally I would go seek some help, right? So I would go to, first step would be the primary care physicians, right? And if you're lucky to have a pediatrician, you might just go to your pediatrician. And if you're lucky to have a GP, go to your GP. So that's how I would start the process off. It is so where I don't know if this is what the pediatrician meant, but usually it's hard for a child to have ADHD and not have it picked up by the school. Obviously, parents know their kids best, so if they might pick it up first. And so if they're concerned about their child for whatever reason, I think it's worth asking for another opinion on, right? As a parent myself, I'd always want to know and get some reassurance. Is my kid okay? This is what I'm seeing. Is this normal? Am I worrying too much? Or do we need to do something about it? And that's where hopefully somebody can give us some reassurance. And often we go to sometimes our doctors to get some of that reassurance.
Thank you so much. And so the next question, there's actually a few different questions that I saw submitted regarding parents who are wondering if they themselves have ADHD. So one, is it possible to get diagnosed with ADHD as an adult, and what is the process for that? And then some other questions related to, as a parent who has ADHD themselves that has already been diagnosed, how can I support my child better, because it can be difficult.
That's a really good question. You know, so this talk focuses mainly on like children and youth, but as you heard and as you know from our talk and from your experience, ADHD is a lifetime spectrum thing. So it doesn't just stop, you know, when you become an adult, and it can cause a lot of impairment. So I would really encourage you to seek out more information about adult ADHD and how that affects someone's life. There are likely support groups out there. There's probably a community, and I don't know which community you're from, but each community is unique. There's going to be special doctors who take a special interest in ADHD. There's going to be psychologists that might have a special inclination towards adult ADHD, right? And there might even be some service centers that know it really well. So for an adult, you know, again, starting with your maybe family doctor, and then progressing from there, right? If you need to seek out an assessment for ADHD would be a really good idea. Okay, so the process is somewhat similar to the one I described, except there are no pediatricians anymore. Okay, so what I would say about parenting a child when you have ADHD, I would say apples and trees. You know, apples don't fall far from trees. And parents often say to me, no, Dr. Chan, thank you so much for giving me the information. Thank you so much for telling me about the different treatment options, including the medicine and the non-medicine. But I tell you what, those the medicines mainly help me at school. Why is this not working for me? Is it me? And so I would say, no, you are wonderful. You are a great parent, but something is standing in your way, and it might be the ADHD. You know, it could be other reasons. It might be that parents disagree with the approach. It could be several other things. It could be health issues, mental health issues that make it hard, circumstances. But something is standing in your way. You are awesome, okay? Never forget that. But something is making it hard. Find out what that is and address it. Then your time will be easier.
Wonderful. Thank you so much. Okay, so the next question is about a parent is asking, how do I know the best way to correct the mistakes or behavior of a child or a teenager, like if they're arriving late at home after going out with friends or forgetting an order, without being unfair with the condition of them having ADHD?
Right. Now that's a really good question. You know, I think future lectures are going to talk about the treatment of ADHD, and it's going to address just this. But what I would say is that it really depends on what behavior you're talking about. So I'm just going to be a bit generic here and assume the behavior is kind of a nuisance behavior. Okay, so first and foremost, the approach with kind of like our children, especially teenagers' behaviors, right? It's going to be lots of opportunities to disagree, right? So is to really kind of choose your battles. You know, I had one pediatrician who I liked what he wrote in his consult. He said there's good behaviors, bad behaviors, then the ugly behaviors, right? And so you kind of got to choose your battles. For behaviors that you like, good behaviors, you always point them out. Thank you so much for picking up your socks. You know, hey, it was great that you packed your bag today. Hey, that was wonderful. Hey, oh, you know what? You made my day easier by doing that. You know, you comment on it, because the more attention you give to any behavior, even especially praise and validation, you're going to increase those good behaviors. So let's say, for example, your child shows up late consistently. 7 out of 10 times shows up late after school if you got a deadline. The 3 times that they show up on time, hey, Johnny, wow, you're here before 4:30 or maybe 5:30, whatever it is. You're here before 5:30. That's great, because now we can all start dinner together as a family. So just by commenting on those 3 times that it happens, you actually increase the time that they're going to show up on time. Okay? And so that may be one strategy, is power of positive reinforcement that I want to leave you with. And the other concept of choosing your battles. So good, bad, and ugly. The good behaviors we talk about, the bad behaviors we ignore because we really can't spend all of our time bickering. And the ugly behaviors, well, those are the ones that you're really concerned about. Then you got to talk about limits, and you got to talk about consistency and things like that. So that can be kind of addressed in future lectures, right? But that's sort of somewhere to kind of start you off with, okay?
Thank you so much, Dr. Chen. So the next 2 questions are questions about emotional regulation and how to help children with emotional regulation. We did host a webinar last week with Miranda Doherty, the occupational therapist who focused on self-regulation strategies for children and youth with ADHD, that talked about this quite a bit. So I encourage you to watch the recording for that one. My colleagues can put the link in the chat. But Dr. Chen also wanted to give you the opportunity, if there's anything that you wanted to mention. So one of the questions was helping a 5-year-old recognize emotions and move through them in a healthy way without throwing rocks or doing something disruptive. And then another question was just general emotional regulation for children with ADHD who might also have other diagnoses like anxiety.
Okay, so that's a really good question. It's many parts to it. Let's see. Okay, so number 1, the behavior you see, for example, the emotional dysregulation, that's coming from somewhere. Identifying where it's coming from is going to be really important in determining what action you take next, right? So I heard the word anxiety, I heard the word, dysregulation. So what I'm saying is you need a translator. I wish parents, myself included, had a translator in my hand, and I would point to it to the kid who's having a behavioral issue or emotional dysregulation, and it'll spit out an answer. He's doing this because, okay? So if the child is in the throes of emotional dysregulation because he's anxious, you're going to have a very different approach than if the child is wanting a popsicle, right? So that's why it's important to kind of be mindful of what's happening to you, in you, and in the child, because it'll kind of determine what you do next. Okay, that being aside, and remember the good, bad, and ugly, right? So sometimes you can just ignore some of this stuff. It's not important, right? Because ignoring works too to help a child regulate, right? So if you give them space, if they're wanting that popsicle and you said no, well, they might just have a tantrum. Okay, but let's take a step back. How do you help a child, right? So let's say you know what it is, and let's say you kind of have a sense as to how to proceed, but you're just kind of wanting to help them gain some control of their emotions. Well, let's presume that the emotions are not dramatic and that they're like a mild upset. In that case, it's often helpful to comment and label the emotion and what you see. So basically validate what you see. So, Johnny, this is really upsetting for you. Yeah. your whole body is super tight. This must be so hard for you. And then just the recognition of that often diffuses a child. The next step, trying to identify an emotion. Are you feeling mad? We're talking about a 5-year-old, right? Is it because you're mad? At this point, Johnny's so mad he's lost his words because he's back in the animal brain of his head that makes him have a fight or flight response, loses his ability to talk. But at this point, he might have calmed down a bit and might nod to you. Yes, I'm mad. Oh, yeah, that makes sense that you're mad. Is it because Jane took your Pokemon card without her asking? Right, yeah, that would make me mad too. Yeah, I get it. And so just the process of validating, pointing out the emotion, identifying what caused it, and then offering maybe a bit of problem solving, or distraction. Would it make you feel better if we did some stomping or deep breathing? Would it help you if you had a banana, or whatever it may be? Or would it be helpful if Jane gave you her card back, right? Something like that could help. That's just sort of like a general template. You wanted to validate, recognize, distract, diffuse, a little bit of self-regulation. As the child gets older, you might enter a program like something like, for example, zones of regulation, where you have green, red, and yellow emotions. And what you're doing is you're not exactly walking them through it, but you might cue them. You say, Johnny, are you in the red zone? Are you in the yellow zone? And that cue alone will give him enough prompting to practice a series of self-regulation strategies, emotional regulation strategies that can help him self-soothe. So that might be what you do for a bit of a later child. I hope that helps.
Wonderful. Thank you so much. And I think we have time for one more question. And as mentioned, if we did not get to your question, Dave, feel free to email us at the Kelty Center and we can support you that way. So the last question is from a parent who's curious about autism spectrum disorder and ADHD, and how do you know which is which?
It can be very difficult. The symptoms, some of the symptoms can overlap significantly. I would say that if you are wondering about it, speak to a pediatrician, because a lot of the signs and symptoms look very similar, and they may need to forward you to a specialist who knows more of the differences. One of the core differences is, well, in fact, in 2 minutes, I can't do it justice. So just forward you to somebody who knows and can talk to you for more than 2 minutes about it.
Thank you so much. So it's 12:59, so I think we'll wrap things up there. So thank you so much, Dr. Chen, for the presentation with all of those wonderful, powerful examples and lending us your time to answer all these questions that came through. Thank you to all of our attendees who joined today and all of your great questions that you asked. As mentioned, contact us if we didn't get to your question. And Dr. Chen, if you just want to go to the last slide in the presentation, we can put our contact information up. So you can email us, keltycenter@cw.bc.ca. We also have a toll-free phone number. You can contact us from anywhere in the province, 1-800-665-1822. And a final note, if you could just remember to fill out the survey that will pop up after the webinar closes. We would really appreciate your feedback on this. It helps us prepare and improve future webinars. And you'll also get a link to that survey in the email that we send out tomorrow with additional resources. So I think we'll wrap things up there. So I hope everyone has a wonderful afternoon. Thank you.
Thank you. Special thanks to our friends at Kelty for putting families and patients first and helping them go through this journey.
Thank you, Dr. Chen.